Hello everyone. Today we are going to discuss a referral letter to the doctor by a nurse. So let's see the case note. Here we'll read the task first, as this is the main thing that you need to keep in mind before starting your task. So the task for today is write a referral letter to the Dr. Silver Bullock, medical practitioner at the Prospect Medical Center, 22 Prospect Road, Prospect 5086, requesting review of your patient to discuss contraceptive options and further testing for sexually transmitted infections and bloodborne viruses. So here what we understand is we are referring the patient to the doctor at this center, medical center, to discuss the contraceptive options and further testing for STI and bloodborne viruses. So let's go to the case notes. Now, today's date is 21st of September 2018. Then, patient name is Julia Roberts. Okay. And her address is given to you, date of birth, and next of kin, her mother and Roberts. Further, journal health of the patient is given to you, and the sexual and reproductive health is also given. Then, her visits. The first visit was on 18th of September 2018 and second was on 21st of September 2018. So, if we talk about 18th of September, Julia presented to the clinic requesting a pap test because that was suggested by her mother, because moreover she was concerned about her weight gain. Then history is given about her reproductive health, then urine PCR test information is given, and the pelvic examination information is given to you. After that, the risk of smoking and benefits of quitting discussed with the patient, then referred to quit line. Also, she was referred to women's health nutrition. Also, she was referred to women's health nutritionist. Then, the next visit was on 21st of September. She was returned for results, that is PCR test, which was positive for chlamydia trachomatis. Patient was informed of results and then she was prescribed this antibiotics, and also she was also advised not to have any sexual contact for 7 days after the treatment. For further testing and contraceptive advice, she was referred to GP. We have understood that two visits are there on 18th September, second is on 21st of September. Now let's discuss how to write a letter. Now, the two most important items for introduction of any referral letter are chief complaint and purpose. Here, the reader, Dr. Silver Bullock, of your letter, he would be more satisfied in finding out the main issue and what is expected to write in. So, we'll start like this. I am writing to refer. This is how we usually start the referral letter. Then, you need to add name, age, marital status also. Like you can write, I am writing to refer Miss Roberts, a 19-year-old single lady. The main issue which we need to understand in this scenario is that patient is found to have chlamydia trachomatis, which is possibly diagnosed, due to which she was referred to the doctor. So, if we write chlamydia trachomatis in the introduction, that lead to more accurate information. How we'll write the introduction is, I'm writing to refer Miss Roberts, a 19-year-old single lady who was diagnosed with chlamydia trachomatis. Now, the last sentence of the introduction would be the purpose, why we are writing the letter. So, she requires your advice and management. So, the introduction would be, I am writing to refer Miss Roberts, a 19-year-old single lady who was diagnosed with chlamydia trachomatis. She requires further advice and management. Now, let's move on to the body paragraph 1. Here, you need to summarize the aspects of past medical history. which are given to us here in general health. If we talk about the general health, we are given about the main aspects that are either normal or not very important here, like no known allergies, no current medications, no significant medical or surgical history, no reported drug use, commenced smoking 11 months ago, smokes 15 cigarettes a day, alcohol on weekends, drinks 2 wine glasses at night. Now, how we'll write this? It will make more sense when we'll write the patient's medical history is unremarkable. This is more good thing. And also, we'll write the things worth mentioning, like she commenced smoking 11 months ago and alcohol on weekends. So how we'll write it in one sentence is, we'll combine all these things. We'll write, she is a regular smoker. Even you can write in bracket that 15 cigarettes per day and drinks moderately on weekends. This is how we can write it. One more thing, in next line we can mention about her weight. We can write, she has gained 10 kilograms over the past 12 months and currently weighs 75 kilograms. So these are the things we need to use and write the paragraph. But do not forget to include some connectors. So how our body paragraph 1 will look like? Let's have a look. The patient's medical history is unremarkable, but she has gained 10 kilograms over the past 12 months. Apart from that, she is a regular smoker, smokes 15 cigarettes a day and drinks moderately on weekends. So this is how you have to combine all of your sentences in body paragraph 1. Now let's move on to the body paragraph 2. The body paragraph 2 here, as the patient's condition might have been caused due to sexual relationships, it is worth discussing about her sexual health. We are already given about monogamous relationship of last 10 months, and here how we'll rewrite it, because there is nothing much more to change it, but yes, we'll write it like this. Ms. Roberts recently ended a monogamous relationship of 10 months and now she has a new partner of 2 months. Okay, let's move on to the body paragraph 2. Here we have to mention the patient's condition that might have been caused due to her sexual relationships. Here we'll not change much of the case notes, but how we'll write is, we'll mention about Ms. Roberts recently ended a monogamous relationship of 10 months and now she has a new partner of 2 months. So we'll include these things in our body paragraph 2. So how our body paragraph will look like? Ms. Roberts recently ended a monogamous relationship of 10 months and now she has a new partner of 2 months. Besides, she has been using oral contraceptive pills since last year and she does not use condoms. Her last sexual contact was 14 days ago. So here we need to mention these things also, because these are also the information about her contraception. So need to mention all together. Now let's move on to the body paragraph 3. Here we need to mention the information regarding her nursing management. We have a lot of information here about her pap test, about her weight gain, about her reproductive health history, and also about the test chlamydia PCR, and also about her PCR test for chlamydia and also her pelvic exam. So how we'll mention? We'll just start like risks of smoking, benefits of quitting, partner risk and safer sexual practice were discussed. We'll just combine these things in one sentence, because these things are the only things which are important to mention. Because if we'll discuss the weight gain here, it has been already discussed in the medical history, and the methods of contraception can be discussed in the last paragraph. because this is the task, main task. Then we talk about her PCR test. So we already wrote chlamydia in introduction, so it will not add any value. So about the patient to return 3-4 days for chlamydia results, this also we no need to mention, because patient informed already of the results, no need to mention. Here you no need to worry about the dates and write entire nursing management in one paragraph. An easy way to do is to find out some common verbs. So that is why I will just write it all together in one sentence. Next sentence will be about her, that she was referred to quitline and the women's health nutritionist, and also about pelvic exam and PCR test. And then we can mention about cervical screening, and then we'll mention about cervical screening information sheet was provided, as well as we'll also mention about she was prescribed azithromycin 1 gram and advised to avoid sexual contact for 7 days after the treatment. So how our body paragraph 3 will look like? This is a little bit bigger, but this will look like this. So this is what I discussed with you. This is how the body paragraph look like. So now the last paragraph, it would be about the requesting message we need to convey to the doctor. It would be like this. It would be greatly appreciated if you could review her and provide contraceptive options and further tests for sexually transmitted infection and blood-borne viruses. And then our concluding sentence, our closing sentence: for any queries, please do not hesitate to contact me. So this is how our essay would be. So you can read the solution on the screen. I'll give you some time. You can just read it and rewrite on your own. I hope I have helped you a lot in this letter, and I have tried a lot to just solve your queries, and just keep on practicing. Stay tuned for the next videos. Thank you. Bye-bye.